Let's go to extraordinary food organs. Talk about the gallbladder. The extraordinary food organs include the brain, the marrow, the bones, the vessels, the gallbladder, and the uterus. Extraordinary food organs are similar to the food organs in morphology and similar to the Zhang organs in function. They have no exterior-interior relationships except the gallbladder. The extraordinary food organ includes the brain, the marrow, the bones, the vessels, the gallbladder, and the uterus. The gallbladder excrete promotes digestion and is similar to the functions of the food organ. And it also stores bile and is similar to the functions of Zhang organ. Therefore, the gallbladder not only belongs to the six food viscera, but also to the extraordinary food viscera. Extraordinary food organs have no exterior-interior relationships and the five elements attribution, except the gallbladder. The brain is located in the skull and is composed of marrow, and it has three physiological functions. One is it dominates life activities. The brain is a vital center which dominates important life activities such as respiration and heartbeat. It also dominates mental activities. The functions of the brain attribute to the heart and belong to the five Zhang organs. When the brain is normal in function, the person will have good energy and will be in full vigor with clear mind, quick thinking, good memory, fluent speech, and normal emotion. On the contrary, abnormal function of brain will lead to SAG, retard thinking, amnesia, and even mental disorders. It also dominates sensation and movement. The eyes, ears, mouth, nose, and tongue are the external orifices of the five organs. They are located in the head and face and are connected with the brain. Therefore, the brain controls the five sensory functions as well as the movement. When the brain is in normal function, it provides good vision and audition, normal olfactory sense and speech, as well as powerful limbs. On the contrary, it will cause dim vision, deafness, anosmia, slow motion, dyskinesia, and speech problems. The function of the brain attributes to the five Zhang organs and is closely associated with the 12 meridians as well as the 8 extraordinary meridians. For example, the heart houses the mind, the lung houses the corporeal soul, and the liver houses ethereal soul, the spleen houses thought, and the kidney houses the essence. Clinically, mental activities are mostly related to the heart, the liver, and the kidney. The heart governs the mind and all mental activities. The liver governs dredging and dispersing functions, as well as regulates mental activities. And the kidney stores essence in order to produce marrow to nourish the brain. That is why mental diseases are usually treated by regulating the heart, the liver, and the kidney. The uterus. Its physiological function is it governs menses and pregnancy. The uterus governs menses, and the production of menstruation is a reflection of the viscera, chi, blood, fluid, and meridians acting on the uterus. Therefore, the developmental condition of the uterus influences the production of menstruation. For pregnancy, normal menstruation results in the normal fertile ability in women. The physiological functions of the uterus are related to the kidney, heart, liver, spleen, chi, blood, body fluids, and the Chong and Ren meridians. The level of essence storing in the kidney and the regulation of the Chong and Ren meridians is especially important. The essence stored in the kidney can promote genital growth. Tiangui produced by kidney, the essence is considered as the basic conditions of maintaining normal menstruation and conceiving fetus. The main component of the menses is blood. The heart governs blood, and the liver stores blood and promotes circulation of blood. The spleen serves as a source of qi and blood and controls blood circulation inside the vessels. Therefore, the function of uterus is closely related to the heart, the liver, and the spleen. The Chong and Ren meridians originate from the uterus. They propel qi and blood to nourish the uterus and conceive fetus. If the function of Chong and Ren meridians are abnormal, it will result in irregular menstruation and will result in metrorrhagia, amenorrhea, and infertility. Thank you so much for your attention.
Let's go to interviewing for eye pain. We have here the differences between full or excess or empty and deficient character of eye pain. So for the onset, okay, a full or young character of eye pain would be sudden. It occurs during the day and morning, and it's chronic and persistent. While the empty or yin character of eye pain would be gradual, occurs at night, afternoon, and chronic on and off. The full or young character of eye pain will have swelling. It would be severe or unbearable, inflamed, red and hot, and pressure would be worse with pressure. For the empty or yin eye pain, there is no swelling. Intensity would be dull or mild, no redness, it is not hot, and the patient feels better when you apply pressure. Temperature, for full or young eye pain, it's worse with heat, better with cold, and there is pain with irritability because it affects the liver, and pain would be like needles. For empty or yin eye pain, worse with cold, better with heat, and the pain would be without irritability because there is yang deficiency and the pain is mild. Full or young eye pain would be worse after eating, and there would be redness and the excretions are affected. So we're referring to urination and defecation, and there will be moving of the eyeballs. For empty or yin eye pain, the patient feels better after eating and it is worse when hungry. No redness and the excretions, the urination and defecation are not affected, and the eyeballs are not moving. Eye pain should be differentiated according to its radiation. If the pain radiates to the occiput, the greater yang channels are affected. If it radiates to the sides of the head and the outer corners of the eyes, the lesser yang channels are affected. If it radiates to the nose and teeth, the bright yang channels are affected. And if it radiates to the top of the head, the liver channel is affected. Eye pain should be differentiated between internal and external. Furthermore, internal eye pain should be differentiated between deficiency and excess. Eye pain of external origin is mainly due to invasion of wind heat and is characterized by sudden onset, sticky eyelids, and streaming eyes. Eye pain of internal origin should be differentiated between deficiency and excess. The most common internal excess types of pain are liver yang rising, liver fire, heart fire, liver wind, dump heat, phlegm heat, blood stasis. Eye pain from a full condition is often accompanied by swelling and dampness. The most common types of eye pain due to deficiency are liver blood deficiency, heart blood deficiency, and kidney deficiency. Thank you for your attention.
Yang Shen 2. Difficulty adhering to dietary recommendations. When we start to tinker with people's eating habits, we must be aware that there are many reasons why people eat. They do not eat only to create qi, or in Western physiology to ingest nutrients such as carbohydrates, oils, proteins, minerals, vitamins, and so on. We mainly eat for a whole host of other reasons, most of these being psycho-emotional reasons, like habit, social interaction with friends and family, traditions, culture, pleasure, business meetings, social gatherings, desire, our cravings, boredom, comfort, security, reward, procrastination, curiosity, fashion and fads, beliefs, therapy, and patterns of imbalance such as stomach fire. Something we should keep in mind when we give people dietary advice is the very first experience this person had when they left the dark, warm, secure, and quiet existence of their mother's womb and entered into a noisy, scary world. This experience was to be taken up to their mother's breast, hear her heartbeat, feel her warmth, and have something sweet enter into their mouth. When they cried as a baby, whether it was because they were hungry, had pain, or were insecure, their mouth and stomach was filled with sweet breast milk or sweet formula from a bottle. In this way, a connection was formed between the consumption of something sweet and comfort and security at a time when their psyche was in the process of being formed. The connection between the consumption of something that tastes good, especially something sweet, and emotional well-being was reinforced for many people when they were given something sweet to eat if they had fallen or hurt themselves as a child. A person may also have been rewarded with something sweet when they had excelled themselves or been good. Christmas, birthdays, and other celebrations were often social gatherings that were associated with happy memories, but also subconsciously with the consumption of something sweet. From a Chinese medicine perspective, not only would the spleen and thereby qi have been nourished in these situations, but also the sweet taste would have been inexplicably associated with pleasure, comfort, and social contact, things that nourish the heart qi and the shen. It is therefore no wonder that many people comfort eat, especially cakes, sweets, and chocolate when they are sad or insecure, feel challenged, or are just bored. Furthermore, we know that most of the patients we meet in the clinic are spleen qi shu and will therefore also have cravings for the sweet taste. This is because it is a body signal to the mind that it is time to take action and strengthen the spleen qi. Furthermore, people with stomach fire, who again form a significant portion of the clients we see, will have an increased or an insatiable appetite. All these factors can make it difficult for the person to control their dietary intake in a reasonable and appropriate manner. Conflicting advice. Another problem we have to deal with is that our advice may be in conflict not only with advice given to the patient by their Western medical doctor, but also with advice they have received from other practitioners of complementary medicine. Some clients are used to our perception for what is healthy being at odds with the views of Western medicine, and some expect this. Unfortunately, it is not rare that other complementary medicine therapists have given them advice that we do not necessarily think is appropriate to their condition or their constitution. Fortunately, there will most often be consistency between our advice and that of others. For example, it is typical that when there is damp heat and spleen qi shu, the patient must have been diagnosed as having a candida imbalance by a naturopath. However, a difference in this situation could be that we may also have diagnosed liver qi stagnation. This means that even though there would be no conflict between the foods we think that they should stay away from and the foods that naturopath has prescribed, we will often be more flexible and less restrictive in our recommendation than the naturopath is. This is because we do not want to create frustration and irritation in the patient by giving them too many rules and restrictions. Furthermore, we may well also have recommended exercise and discuss the effects that frustration and irritation can have on their imbalances. Where we often come into conflict with the advice and opinions of both Western and complementary medicine practitioners is with regard to how much water a person should drink and the use of ice when there is a physical injury. In these situations, our advice can sometimes seem almost heretical. The problem is that clients with chronic conditions, example, those who make up the bulk of our client base, are often people who see several therapists simultaneously or consecutively. This can result in a confusion when they get conflicting advice from the different practitioners. The only things we can do are to try to, one, find a common denominator in the advice that they have been given and our advice. Two, be convincing in our explanation of how we comprehend their body physiology, pathology, and etiology factors. Thank you for your attention.
So let's proceed to diagnosis according to 4 levels with blood heat, injuring yin. In this pattern, the extreme heat injures yin. There will be classic yin deficiency symptoms and signs, but they will be very extreme and the condition will have arisen as a consequence of an invasion of exogenous pathogenic qi. There may well be an underlying yin deficiency condition, which means that when there is heat, yin has greater difficulty controlling it and is more easily injured by heat. It has its etiology in pathogenic qi that has penetrated from the qi or yin level. Symptoms and signs: fever that is higher in the evening and at night, no sweating when the fever has fallen, red face, a sensation of heat in the palms of the hand and soles of the feet and chest or the five palm, heat, dry mouth, weakness of the body, wizened body, deafness, irritability, restlessness, red tongue without coating, rapid and fine pulse. The key symptoms, fever that is worse at night, five palm heat, wizened body, rapid and fine pulse. Treatment principle to rescue yin. The acupuncture points to choose from are the jewel points, bladder 40, spleen 10, LI 11, kidney 1, kidney 3, kidney 6, and REN 4. Needle technique, draining on bladder 40, spleen 10, and LI 11, and tonifying on kidney 1, kidney 3, kidney 6, and REN 4. To explain the use of points, for the choices of points, the jewel points, bladder 40, spleen 10, and LI 11, drain blood 3. Kidney 1, kidney 3, kidney 6, and REN 4, rescue yin. The person will probably be in the intensive medical care. So blood heat injuring the yin can be caused by the following patterns of imbalance: qi level heat, yin level heat, and in turn this can result to yin and blood deficiency. Thank you for your attention.
Let's go to visceral manifestation theory, formation. The human body is a very complex organic body. It is a functional system composed of many tissues and organs. Its principal components include the Zhang and Fu viscera, the non-organ structures, the sense organs and orifices, the material basis of vital activities like essence, qi, blood, body fluids, etc., and the meridians. Knowledge of the structure and functions of the body systems in CM has been obtained through observation of the manifestations of many physiological functions and pathological phenomena in the body. As this knowledge accumulated, it was taken a step further and became formulated as a visceral manifestation theory. The foundation established by this theory comprises principally the following three aspects. First, ancient anatomical knowledge. As early as the eras of the spring, autumn, and of the warring states, Huangdi's internal classic already contained descriptions of findings from the dissection and research of the human body. For example, the spirit pivot states, a man is about 8 qi in height. His size is measurable on the skin and flesh, and his body may be dissected and inspected after death. The firmness or fragility of the Zhang viscera, the size of the abdomen, the quantity of the food in the stomach, the length of the vessels, and the clarity or murkiness of the blood, they all have measures. The internal classic further contains a more detailed account of the circulation of blood, describing not only the formation of blood, its nature and functions, but also the source that powers its circulation, the internal organs that it flows through, and its rate of flow. This early anatomical knowledge established the foundation of the visceral manifestation theory. Second is a long-term observation of physiological and pathological phenomena. By applying the principle of inferring the interior from the exterior, the ancient physicians carefully studied in detail and over a long period of time the external manifestations of the physiological and pathological phenomena of the human body and gradually recognized the rules. For example, when the skin was chilled, the common cold could develop easily and manifest such symptoms as nasal discharge, cough, and the absence of sweating. From such observations, the ancient physicians inferred the relationship of the nose and skin to the lung. Based on this relationship, they formulated the theory that the lung has its orifice in the nose, and the lung governs the skin. Another example was that when people were anxious, they often had poor appetite and dyspepsia, and occasionally abdominal distension. After many years, the ancient physicians linked the mental distress of brooding to the digestive function of the spleen, leading to the theory that the spleen controls brooding, and excessive brooding damages the spleen. These were concrete examples of inferring physiological function from pathological changes. Number 3 is a summarization of practical experience. During the long period of struggle against diseases, the ancients observed that the certain pathological phenomena were related to the dysfunction of certain viscera. In particular, they learned to infer the functions of the viscera from the results of therapeutic intervention. For example, the relationship between the liver and the eyes was difficult to establish in physiology. However, many types of eye disorders could be cured by techniques that treated the liver. Based on these observations, they gradually formulated the theory that the liver has its orifice in the eyes. Another example was that the healing of bone fractures and the stimulation of scalp hair growth that resulted from strengthening the kidney. From the physicians formulated theory that the kidney governs the bones and the splendor of the kidney is in the hair. It is clear that the theory of visceral manifestation in CM is based on definite anatomical knowledge. It principally employs the research method of empirical observation of people's daily lives and of bedside clinical activities over many years, formulation of theory from these observations, and followed by refinement through repeated clinical corroboration, finally culminating in the unique theory of visceral manifestation. Thank you so much for your attention.
Diagnosis according to Zhang-Fu organ patterns, spleen yin deficiency. Most modern textbooks refer to yin deficiency conditions in the heart, liver, lung, and kidneys, but not in the spleen. Nevertheless, there have historically been discussions and disputes as to whether the spleen also has a yin deficiency pattern. Many authors argue that the spleen cannot be yin deficient for the simple reason that the spleen detests dampness and prefers dryness, while others believe that the spleen yin deficiency is not only seen in practice, but can also be justified theoretically. Spleen yin deficiency will often be diagnosed as the combined pattern of spleen qi deficiency and stomach yin deficiency. From an acupuncture perspective, the differentiation between these two patterns and spleen yin deficiency will only have academic interest, as the treatment will be largely the same. Spleen yin deficiency can arise through chronic overexertion, and excessive consumption of hot, spicy food and medicines can injure the spleen yin. Spleen yin deficiency can be both a consequence and the root cause of yin deficiency in other organs. This is because the condition will impair the spleen's transformation of the fluids that have been ingested, and this is the first stage in the production of qin yin. Symptoms and signs: bloated abdomen after meals, easily sated and can only eat small meals, epigastric fullness, no or poor sense of taste, dry lips, dry mouth, oral ulcers, thirst that is easily quenched, burning sensation in the stomach or the abdomen, matte complexion, weight loss or lean body, dry stools, weak or fatigued limbs, sensation of heat in the palms of the hands and soles of the feet, red and dry tongue that lacks coating, possibly red and peeled in the central area. There may be cracks on the tongue. Fine and rapid pulse. Key symptoms: dry mouth and lips, easily sated. The central area of the tongue is red and lacks coating. Treatment principle: nourish spleen yin. Acupuncture points: we can choose from spleen 6, Ren 12, stomach 36, and bladder 20. Needle technique is tonifying. Spleen 6, Ren 12, stomach 36, and bladder 20, nourish spleen yin. A person who is spleen yin deficient should avoid eating food that is hot and spicy. They will benefit from eating food that has a slightly sweet flavor, but they must also be careful that they do not create dampness. This is a fine balance because spleen yin should be moistened and nourished, but as this is a spleen deficiency condition, dampness can easily arise. Spleen yin deficiency can be caused by stomach yin deficiency, stomach fire, kidney yin deficiency, lung yin deficiency, heart yin deficiency, and liver yin deficiency. And this can result in stomach yin deficiency, kidney yin deficiency, liver yin deficiency, lung yin deficiency, heart yin deficiency, dampness, and food stagnation. To recap, let's discuss the etiology of spleen yin deficiency, excessive consumption of cold and raw foods which hinder the spleen, irregular eating and eating too much, excessive mental activity, prolonged exposure to damp, chronic illness, injuring yin. Underlying or accompanying pathology: spleen qi deficiency, liver and or kidney yin deficiency, stomach yin deficiency. Signs and symptoms: poor appetite but with no desire for food or drink, poor digestion, sallow complexion, gnawing hunger, poor sense of taste, epigastric discomfort, dry mouth, dry lips, dry stools, hiccup, night sweats, tip of the nose may be red. Pulse is weak or floating and empty. Tongue is peeled with transverse cracks on the sides. Treatment principle: supplement qi and fortify the spleen, boost the stomach, and nourish yin. Acupuncture treatment. REN 12 to fortify stomach and spleen. Spleen 3, this is the source point of the spleen. Spleen 6 to nourish yin, clear empty heat. Bladder 21 to supplement the stomach and spleen chi. Stomach 36 to boost spleen, stomach chi. Kidney 6 to nourish yin, clear empty heat. Bladder 20 to supplement spleen and resolve dump. Needle with supplementation. Thank you for your attention.
Chi. Movement, classification, and genuine chi. Chi can move in many ways, but these ways can be grouped in 4 basic patterns: ascending, descending, exiting, and entering. The Zangfu viscera, the meridians, the tissues, and other organs are all places for chi movement, and chi movement is basic to the body's vital activities. Once chi moving stops, the life comes to an end. Chi is the motive force that propels and stimulates many vital activities of the body, but its actions can be seen concretely only in the activities of the organs, tissues, and meridians. For example, the lungs' respiratory exhalation reflects chi exiting, and inhalation its entering. The lungs' dispersion action reflects chi ascending and depuration descending. The spleen and stomach are in charge of digestion. The spleen raises the clear, so it is healthy when its action is ascending. The stomach lowers the turbid, so it is harmonious when its action is descending. The coordination and equilibrium between these 4 basic types of movements is called the harmony of chi mechanism. When this harmony of chi is disturbed, the situation becomes one of disharmony of the chi mechanism. There are many types of disharmony of the chi mechanism. For example, failure of the lung in dispersion, depuration, and descending may lead to the sinking of spleen chi, adverse ascent of stomach chi, stagnation of liver chi, or disharmony between the heart and the kidney. Comparison of genuine chi, thoracic chi, nutritive chi, and defensive chi. So for genuine chi, our common point would be food essence as the respective composition. The formation is derived from innate chi supplemented by acquired chi. The distribution is throughout the body by Sanjiao. The actions, it promotes growth and development, stimulates functions of Zangfu viscera and meridians. And the feature is the primary motive force for vital activities. Then we have the thoracic chi. Common point is also food essence as their respective composition. Formation is combination of essence from food and fresh air. Distribution is upward towards the throat, running through the heart and lung, going down to the dantian, pouring into the stomach meridian. Its actions promotes lung respiration, energizes the heartbeat, regulates heart rate and rhythm. And its feature, its state, can be assessed by the pulsation of the apex of the heart. Now, the nutritive chi is derived from the essence of drink and food. It is derived from essential chi of food and drink. It circulates within blood vessels. It nourishes the whole body, and its feature is cream and softness. Now, the defensive chi circulates outside blood vessels. It protects and warms body, maintains the body temperature, and it is vigorous, smooth, strong, with rapid flow. Genuine chi is also called original chi or primordial chi. It is the most fundamental and important chi of the human body and the primary motive force for the vital activities. For its formation and distribution, genuine chi originates from the kidney through transformation of the kidney's innate essence. It also depends upon acquired essence from drink and food for supplemental nourishment. Following formation, it flows throughout the body via the Sanjiao, in the interior to the Zangfu viscera, and in the exterior to the muscles and skin. It has actions in all parts of the body. The physiological actions. The principal actions of the genuine qi are to promote growth and development of the body and to warm and stimulate the physiological activities of the viscera, the meridians, the tissues, and the organs. If genuine qi is ample, then the zangfu viscera, the meridians, and the organs are vigorous in their activities, and the body has a strong constitution and is relatively free of disease. If genuine qi is deficient because of insufficient innate endowment, inadequate postnatal acquisition, or damaged by prolonged illness, many illnesses may ensure. Thank you for your attention.
Let's now talk about dizziness and its etiology. Dizziness in Chinese medicine is called Xianyun. Xian means blurred vision, while Yun means dizziness. This symptom may range from a very slight dizziness, sometimes only on changing posture, to very severe vertigo with loss of balance and when everything around the patient seems to be spinning. The term dizziness also includes the very common sensation of muzziness or fuzziness, a heavy feeling as if the head was full of cotton wool, and linked to this, an inability to think properly and to concentrate. In English, we call the symptom Xianyun as dizziness and use vertigo to indicate a stronger sensation of dizziness to the point of losing balance. The first reference to dizziness occurs in the Yellow Emperor's Classic of Internal Medicine, which links it to various patterns. The simple questions in chapter 74 relates it to liver wind. Wind causes dizziness and it pertains to the liver. The spiritual axis in chapter 28 attributes dizziness to qi not reaching the head. When the qi of the upper burner is deficient, the brain is not full, and this causes dizziness and blurred vision. It also relates it to deficiency of the C of marrow. When the C of marrow is deficient, there is dizziness. Zhu Zhenheng, or Zhu Danxi, in Essential Methods of Danxi, relates dizziness to phlegm and goes as far as saying, there is no dizziness without phlegm. He therefore advocates resolving phlegm as the main method of treating dizziness. As we shall see, phlegm is a very common cause of dizziness in the elderly. Zhang Jiebing, or Zhang Zhengye, on the other hand, in his book, The Complete Book of Jingye, relates dizziness to deficiency and says, deficiency above causes dizziness, and there is no dizziness without deficiency. He therefore recommends tonifying as the main method to treat dizziness. The differentiation and treatment of dizziness, together with those of headaches, can be used as a guideline to treat hypertension. Now let's go to its etiology. First, emotional strain. Anger, frustration, resentment, bottled up hatred, and any other emotion that affects the liver may cause liver yang to rise. This is a common cause of dizziness in the full type. On the other hand, prolonged stagnation of qi from emotional strain often gives rise to fire, in this case, liver fire, which may also cause dizziness. Moreover, liver fire may generate wind, which causes even more intense dizziness to the point of loss of balance. Overwork or excessive sexual activity, especially in men, over many years without adequate rest weakens the kidneys. This fails to generate enough marrow to nourish the brain and dizziness results. This is dizziness of the empty type. Next is irregular diet. Excessive consumption of greasy food or dairy products or simply irregular eating may weaken the spleen and lead to dampness and phlegm. When this is associated with the deficiency of qi in the upper burner, the clear qi cannot rise to the head and turbid phlegm stagnates there, giving rise to dizziness, blurred vision, and a sensation of muzziness or fuzziness and heaviness of the head. Thank you for your attention.